Module 2, Lesson 1, Controlling Blood Sugar. Welcome to Module 2. In this module, we will learn how food, weight, and blood sugar are linked. We will also learn how to control blood sugar and weight with food. In our first lesson, we're going to learn how to control high blood sugar. But first, let's quickly run through what happens in type 2 diabetes. In the last module, we learned the pancreas produces insulin in response to the food we eat. We also learned how the pancreas gets overworked and is no longer able to produce insulin when we eat more food than we should over a long period, and how these changes lead to diabetes or high blood sugar. What then are the problems that occur with diabetes? The first is that food or carbohydrate consumption is too much, and the second is that there are problems with insulin since insulin is required to keep blood glucose levels normal. Now that we've identified the problems, how do we solve them? For excessive carbohydrate or food intake, the logical solution is to decrease the quantity of food consumed. We all know that eating good food is very enjoyable and we get pleasurable sensations when we eat. So, what foods should we give up? This is what we will be addressing, so just hang in there. Now, for problems with insulin, let's take it step by step. If we can recall, when there's too much insulin or insulin isn't working, it means the pancreas is trying to respond by churning out higher levels of insulin. Insulin forces excess glucose to be stored as fat, so when the pancreas is churning out large amounts of insulin, the consequence is that patients get fatter. Decreasing food or carbohydrate intake leads to decreased insulin production and eventually weight reduction. Exercise or physical activity also helps by making the cells respond better to insulin. When we exercise, we use up some of the glycogen stored in the muscles and liver. If we exercise for long periods, like marathon runners or athletes do, we use up all the glycogen stores and then begin to use up our fat stores as well. This frees up storage for glucose, so cells that were filled up and no longer responding to insulin have free space and can respond to insulin again. To solve problems that occur in type 2 diabetes when insulin is not effective or when insulin levels are too high, reduce food intake, lose weight, and exercise. There's a fourth method not yet mentioned, and that is drugs. Drugs can be used for problems with high insulin levels when insulin is not working or when insulin production is reduced. There are different types of drugs and they act in different ways. Some increase insulin production, while others help insulin produced to act better. When insulin levels are too low to be detected or no insulin is produced at all, as occurs in type 1 diabetes, then insulin has to be administered. Insulin is a protein, so it can't be swallowed like a tablet, as it will be digested in the stomach. This is why it is given as an injection. Not many people are comfortable with giving themselves injections. The next thing is that insulin should be stored at a certain temperature range, between 2 and 8 degrees centigrade. It can't be stored in a cupboard, it can't be stored on a shelf, it can't be stored on a table in our room. In Africa, where we live, normal room temperatures are between 16 to 20 degrees. So, insulin should be stored in the refrigerator, and that means there must be constant power supply. For these reasons, it is not a popular method of treatment, and it is expensive. There are insulin pens that have been developed, especially for people with type 1 diabetes or for pregnant women who need to take insulin. They are more convenient to use. The pens can be carried around in your bag or briefcase. Wherever you are, at work, at school, at home, or in a bus, when you eat, then you give yourself a shot. The pens can be stored at a wider temperature range from 2 degrees centigrade to 30 degrees centigrade, giving room for more flexibility, but it is more expensive and is not available everywhere. One common question lots of people ask is, can diabetes be cured? The truth is, diabetes can be reversed. We don't like to say cure because when you talk about a cure, it means the person won't get the symptoms or the disease ever again. From what we've learned, what happens in diabetes is that there are changes to normal systems in the body. If we can get the body to revert to its normal mechanism, the disease disappears. To return insulin levels to normal, all one needs to do is reduce food intake, lose weight, and exercise regularly. When these result in normal blood sugar levels and the patient is able to do without drugs, diabetes is reversed. However, reversal of type 2 diabetes only takes place if the patient can lose at least 5 to 10% of their body weight. For a patient who weighs 100 kilograms, 5 to 10% is 5 kilograms to 10 kilograms. So the patient's weight must drop to between 90 to 95 kilograms. It's easier to reverse diabetes in the early stages. When the pancreas is producing too much insulin or insulin produced isn't working. At this stage, the pancreas is still producing reasonable amounts of insulin, so if one can lose weight, chances are that the insulin being produced would be enough to control blood sugar. When the pancreas is producing little or no insulin, this is not enough for survival, so reversal is out of the question. It is much better and a lot easier if we tackle diabetes in the early stage. Treatment is more efficient and it's easier to control diet and exercise. You can't change your genes. You're stuck with them, so it's better to control what you can. We've learned that problems in type 2 diabetes result from eating too much food or carbohydrates and having problems with insulin production and action. Secondly, solving these problems require reducing our food intake, losing weight, and exercising. In the next lecture, we'll learn about controlling blood sugar with food.